So I brought in antibody testing here for COVID, SARS-2, and we've been doing it for 3 months. And I just wanted to share with you some interesting observations that we found here in the office, because I actually think it's really cool and been pretty exciting. And I hate to use a disease to say that we're doing something exciting, but as we're learning more about this, I do think it's pretty cool to clinically correlate. And we've had a wide variety of reasons people have done the antibody testing, right? So one is people say, I was sick at some point in time, I swear it was COVID, I want to just know. And it's been fun to see how many positive tests we've had to confirm that that is probably true, versus certainly also a handful of people who thought they had it and really probably didn't because we didn't get an antibody response. We've also been able to use the test to confirm theoretical immunity. And I'll always say theoretical because we're still learning about that as well, to determine if those antibodies are elevated, if it will prevent you or protect you from getting it a second time. And truly, we don't know for sure, but we're hoping that that'll help give you a little more comfort as you're visiting loved ones or traveling in and out of the state. We're also utilizing it to look at transitions. So for example, we just had a young family that came in the other day. They had tested positive for COVID, a little bit spread out. They had retested after going through their symptoms of a negative test on COVID. And because we're concerned that we're seeing reports, although we don't have research, but we're seeing reports that maybe you could get it a second time pretty quickly, we ran their antibody testing because we look at both what's called an IgM and an IgG antibody. And we've shown that if you just have the IgG, you've technically moved through the disease process to what we're calling that theoretical immune state, versus if all you have is IgM, which is a more acute elevation of an antibody, you might still be in an active phase. So we're able to help people too know, is it safe to go back to work? Is it safe to allow family members to come back into the house? And it's been a great tool, although never 100% perfect like any other laboratory test. It's given us a lot of good clinical correlation to help people feel more comfortable, give them more knowledge, and make better decisions. So I love that we're able to offer this and utilize it. We're going to keep doing it. We're also going to keep testing those that are positive 3 and 6 months later to see if they still have the elevation of antibodies. So as we move through this crazy disease that we have out there in the unknown, we can create more information to help you feel better, right? And help you feel more comfortable navigating you and your family members through this challenging time. So any questions at all on the antibody test, love to go over it with you, share my opinion and the information. We're using a really great reference lab that is FDA approved. We do have approval for this test. And after doing tons of homework out there on antibody testing, I am absolutely confident that it is one of the best ones out there. Let us know if we can help you with that. We're going to keep giving you information as we learn it.